afternoon, everyone. Welcome to the UBC Learning Circle, hosted by the Centre for Excellence in Indigenous Health. Today, I'm very happy to welcome Elena Scheffer and Catherine Berry-Einerson from the FNHA. They're going to talk to us today about the Regional Health Survey. We're really excited. Before we begin, I would like to acknowledge that we are on the traditional, ancestral, unceded, and occupied territories of the Hunkaminam-speaking Musqueam people. And I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So as a quick reminder to everyone participating today, the topics we cover in these sessions can sometimes be sensitive or emotionally triggering. If that's you for today, I urge you please engage in some self-care, have a support network ready, an elder, friend, family member, counselor, whatever it is that you need, please make sure that you seek that out. So, quick introductions before we kind of launch into it. My name is Cole. I'm from the Chowethel First Nation. I'll be kind of facilitating the session today. So for the most part, I'll be kind of a decorative prop alongside Elena and Catherine, who are gonna really kind of take us all the way through it. So I'll ask each of you to introduce yourselves a little bit more thoroughly, and then we can kind of launch into it. Should we start with Catherine?
Sure. So thank you very much for the introduction and for the welcome. My name is Catherine Berry-Einerson, and I am the Manager of Surveys and Data Secretariat, and I work with the Research and Knowledge Exchange team at the FNHA. I've actually been with the FNHA since about 2015. I initially started with the Chief Medical Officer's Office, but my whole career at FNHA has been involved in data and data governance. So that's what kind of led me up to doing this survey work.
Cool.
And I'm Elena Scheffer. I am a settler. I grew up on Coquitlam territory, and I have been at FNHA for about 3 months. I am the Senior Coordinator for Data Collection and Analysis for the Regional Health Survey.
Must have been an exciting 3 months. Now you're here.
Yeah, it's been a wild ride.
She's been doing amazing.
Awesome. So this will transition over to the PowerPoint now, I guess. And who's going to be manning the clicker? Who will start?
Catherine can start.
Sure, I'll start. And I know that you did an acknowledgement of the territory, but just wanted to share that my team has been really working on that lately, like really sort of challenging the idea of what does it mean to acknowledge and how are we going to start our meetings in a good way. And so I think the team put together a really nice opening acknowledgement, and it's actually written up on the screen, and I would love to have it memorized and say it, but unfortunately my memory's not that good. And it's really lovely, so if you guys don't mind, I'll just read it because I really do want to share it. Okay, so we would like to acknowledge that we are gathered in person on the unceded territory of the Musqueam First Nation, but that this work was conducted across BC on the unceded territories of First Nations as well as Treaty 8 territory. The Regional Health Survey is a survey of health and wellness of First Nations peoples, the results of which describes the impacts of Canada's racist and sexist policies on the health and wellness, as well as the resilience and resurgence of BC First Nations peoples and communities. As settlers in this work, we benefit from the ongoing colonialism in Canada, and we affirm our commitment to our continued education, accountability, and action to support Indigenous self-determination, sovereignty, and vibrancy. So my goal is to actually memorize that for next time because I think it's really, really lovely. All right, so let's talk about the Regional Health Survey. So the first slide here that we've got up, it's a little bit hard to see, but it's sort of an overview timeline of various historical events that are related to the Regional Health Survey and surveys in general in Canada. So if we start at the left and we look at 1994, I think people are fairly aware that up until around that time, First Nations on reserve were not included in surveys, at least surveys that were done by the government, by Statistics Canada. That's a mouthful. I'm just reading off this because I really can't see what's up there. So around about 1995, the Assembly of First Nations decided that they were going to conduct some national consultations with Indigenous communities and just learn a little bit more about what it was that people were interested in learning about in terms of data gathering and collection. So that led up to about 1997, where they put together a pilot survey, and people might have heard of that, the First Nations Regional Longitudinal Health Survey. And actually, I'll be honest, I didn't realize that that was only a pilot up until recently. And it was kind of interesting because if you look through a lot of First Nations health research today, you'll see a lot of references to that original survey. So as a result of that, they had a lot of learnings, and in 2002, data collection began for the first phase of the RHS. So RHS 1. There's a couple of other dots on there. Some of them are about FNH history, FNHA's history. So for example, in 2005, you had the Transformative Change Accord First Nations Health Plan. And then in 2007, it was the Tripartite First Nations Health Plan. And those are really important waypoints in our history in terms of data. So in 2010, the First Nations Information Governance Center, which we'll call FNIGC throughout the presentation, was formed, and it was designed to be the national organization for data collection for the Regional Health Survey. In 2013, that's when FNA transitioned and assumed all the program services and responsibilities for First Nations Health in BC. 2014 was an interesting year too. As we'll learn a little bit later in this presentation, the Regional Health Survey was only funded for a small number of communities, and as a result of listening to feedback from communities and regions, we heard that a lot more people wanted to be involved in the data collection. So FNHA did put forth some extra money to really expand that, and we'll talk about that a little bit later. It's pretty cool. So we're looking forward here to 2015. When data collection started for the second phase of the Regional Health Survey, and that's when FNHA became involved. I think we actually picked that up partway through. Okay, no, I'm wrong. I'm sorry. I believe we did come partway through for the second phase now. My memory is serving me correctly. And then for the phase 3, that was all ours. And data collection started in 2015, ended around 2017. And we have a little bit of a future plan on here. So we're currently just in the end stages of the third phase of the Regional Health Survey. And we're starting looking forward to the fourth phase. And data collection is going to start next September. So in September 2020. And I realized it says 2021 up there, but we're aiming for September 2020.
Okay.
So what is the First Nations Regional Health Survey? We can skip to the next slide now. It's the only First Nations-led and governed nationally representative population health survey. It's a really exciting survey because it asks a lot of questions about health, health status, health outcomes, and also a lot of questions about social determinants of health. So what are some of those really core structural factors that influence how health is shaped? So it influences our chances and our opportunities to really achieve good health.
Mm-hmm.
Up until the Regional Health Survey was done, like I mentioned, we really didn't have a clear picture in terms of data of what that looked like because the data wasn't collected.
Mm.
In terms of being nationally representative, the Regional Health Survey in BC has been sampled so that estimates are weighted to be representative of all First Nations living on reserves in BC. I'm not going to describe how that works. It's about sampling and weighting, and it's fairly complex and full of mathematical numbers that I don't fully understand. But safe to say that when the survey is done of a smaller proportion of people, there are techniques that are used to allow our analysts to extrapolate and to, what's the word I'm looking for?
I guess generalizability.
Thank you. Create estimates of what is real and true in the First Nations population in British Columbia. It's kind of really cool work. Another thing that I wanted to say that's really important and fundamental to the Regional Health Survey in BC is that it is guided by the principles of OCAP. And so if folks haven't heard about the OCAP principles, they're really a set of principles that can help guide First Nations health research. So the O stands for ownership, and it's talking about who actually owns the data that is created. And in this case, it would be First Nations people owning First Nations data. Control. So who is controlling the data that is collected? Who has a say in what happens to it? Access is fairly straightforward. So that determines who will actually be able to access the data and use it. And then P is for possession. So possession is about stewardship, and stewardship basically means having the responsibility of taking care of the data in a good way and making decisions that are going to benefit present generations and also future generations. It's a really cool concept when you think about it in terms of data. We don't usually hear that. We usually hear about stewardship in relation to the land, and I think it's a very similar concept when you apply it to data, taking care of it and nurturing it.
Mm-hmm.
Okay, so moving on. Speaking of OCAP, privacy and consent are a really important piece of this survey. We did a number of layers of different privacy, I guess you could say privacy protection. So one of the things was a privacy impact assessment, and that's done internally with our organization just to determine if there's anything we should be aware of, with this survey in terms of how the data is collected, stored, managed, and to ensure that we are keeping confidential the information that we're collecting from people, that people are not able to know who is providing the data. We also have what we call a data protection and stewardship protocol, which was given to us by the First Nations Information Governance Center, and that is quite comprehensive in terms of how data is protected. Community consent is interesting. I don't think I've heard of any other survey where the consent process begins by inviting communities to participate, and when they have agreed to participate, they actually are required to fill out a consent form on behalf of the community before we can do any data collection or even any sampling. So that would be any individual participation. And then of course we have an individual participation form, which is a pretty standard consent form for any survey that's done.
Okay.
Another really neat feature of the Regional Health Survey is regional engagement. So that's why it's called the Regional Health Survey. And from my understanding, engagement with the regions has been a really key part of this from the very beginning. So in terms of data collection, before it even happened, back in 2015, 2016, the Research and Knowledge Exchange team held some data governance forums around the province. And there was a lot of information collected there that sort of fed into the base of this survey and how it was carried out in BC. I should actually, at this point, because it says regional field supervisors up there, I should mention that the team as it is today is actually fairly new. I think the longest serving team member has been there about 1.5 years, and all of this work was done by our regional team. Just a tremendous amount of work. Data collectors, field supervisors, field staff, engagement coordinators, both FNHA staff, community staff. So I just wanted to put that out there that we owe a huge debt of gratitude for all the work that they've done, and we're fortunate enough just to be able to carry it on and finish it up and move on to the next stage. So in terms of data collection and regional engagement, as much as possible, the survey utilized locally hired data collectors and supervisors. The reason for that is because the data was collected at a location that was convenient for the participant. So in some cases, it was in people's homes. So the collectors would be invited into people's homes, which is really neat. Sit down at the table, fill out the survey, have a cup of tea. So that's why it was really important to have local community members present for the data collection. In terms of data analysis, there was a lot of engagement done on figuring out what to report on. So if you can just imagine, you have this survey with
200 questions.
200 questions.
Wow.
That is a lot of information. That's like literally thousands and thousands of data elements that are possible to report on. So rather than just make the decisions ourselves and say, okay, we're going to report on this because we think it's important, we went out to the regions and said, okay, this is your data. What do you want to know? What is it important for you guys to hear about? What are your areas of interest? 'Cause you have to narrow it down. If you did a report on all of the indicators, it would probably be, thousands of pages long. No one's going to read that. In terms of indicator selection, that basically ties into the areas of interest. So anywhere there was an area of interest, it was reported on in the report. In terms of knowledge exchange, last year there were some presentations at the regional caucuses. We've actually been very busy right now talking to regions and regional staff about the results of the report and just sharing some information about the reports that are were published last week. They've been printed and they've been mailed out, so people should start receiving them very soon. They're going to be available on the web next week, and we'll talk a little bit more about that later. We also have a regional advisory committee who were quite active throughout this whole process, and we just this week had our first regional advisory committee meeting for the next phase of the regional health survey, so that was really exciting. Okay, so as I mentioned previously, the initial funding from FNIGC was only about enough for about 32 communities or so, so really only a small sample. And when you have smaller numbers, it's really hard to report with any certainty and accuracy on some of these indicators. So we heard from regions that there was a lot more interest to be involved, and so FNHA decided, okay, let's put some more money towards this, and we ended up doing a lot more sampling. I think in Fraser Salish, Vancouver region, and the interior region, everybody was invited to participate. And then participation was a little bit lower in the north just because of the geographic diversity. We weren't able to include all of the communities in that. So in the end, there were about 5,700 people and 122 communities participating, which is actually quite phenomenal. The way that this particular sampling framework was done means that we were able to report on data at the regional level. Previously, it was only reportable at the provincial level. So I think this is actually the first time that that's happened where we can provide the data on a regional basis. That's kind of exciting. Do you want to talk about the sampling framework?
Not much more other than what you said, that this is, because of the expansion, there's the regional data is really high quality. Like, you can just see how many, there are so many participants in each region, and so that's really important in terms of returning data that's meaningful, is making sure that people feel and are represented in the data that they're receiving, the results.
It's actually quite an interesting way that they sampled. So the first run through, they decided, okay, these are the communities that are going to be included. And then after that, they decided, okay, these are the individual participants that are going to be included. And the way that they determined the individual participants was through, I think, community membership lists. It was actually randomly sampled.
Okay.
We had a lot of assistance from people who were responsible for membership within the different bands. Okay, so we're going to talk just a little bit about data collection. And this is a photo of the data collection team from the last phase of the regional health survey. These people live all over the province. Okay, now this is the fun stuff. In terms of reporting, we ended up producing 1 provincial report and 5 regional reports, so 6 in total. Plus, in addition to the reports, the regions will be receiving tabular data of the region, which won't be public. It'll be for the use of the regions to do what they would like. And this data is actually going to be the full set. So all of the data that was collected, and not just the selected information that was included in the report. So that's quite exciting. I think that's the first time we're doing that as well. Okay. So these slides here, these are actually the covers of the regional health reports. So that's for the provincial report.
Yeah, they are. Very beautiful. Lovely colors.
Yeah, those are for the regional colors, the FNHA regional colors. So
Cool.
they'll come up again because we'll be doing some provincial level results and then some regional results. No?
Only provincial results.
Okay. Yeah. My apologies. We'll be doing provincial results here. Okay. So in terms of analysis, in the reports, all you will see are descriptive statistics. So what that means is we're essentially giving back what was reported to us. We're not doing any fancy mathematical or statistical tests to determine something like cause and effect relationship. It's really just describing what
you saw.
Yeah, what we saw.
Okay.
But we have a program ongoing right now in partnership with Simon Fraser University, where we are hosting a few First Nations students from BC. They're doing a Masters of Science program, and they're going to be conducting secondary data analysis with that data. So they're going to be looking at those cause and effect relationships between different variables. It's quite cool, I think. And also just wanted to mention that in addition to these reports, the data has been used or will be used, hasn't been released yet, in a couple of other reporting work that the FNHA is doing. So there's a population health and wellness agenda coming out in January, which is really exciting. And that's basically just a suite of indicators to measure population health and wellness. And then there's also an Indigenous women's health report that's going to be released in the future, and that will contain a little bit of the data from the RHS as well. Now I think we're going to move on to some results from BC.
So I'll be speaking to some of these results. So again, we'll take a look at this beautiful report cover. So as Catherine mentioned, the reports were guaranteed to be in community on September 23rd. Yes. And the public release is on Monday, the 30th. So these are about to be released to the world. And and so as Catherine mentioned, as part of the actual report preparation process, there was a lot of engagement done in terms of kind of seeking advice from the regional advisory committees, and other advisors about really what are the kind of key areas, what are the things to highlight in the reports. And so these three areas were all identified they were identified in common in all of the regions in engagement. So all regions wanted to really highlight the results for traditional wellness, mental health and wellness, and then also primary health care. So today we're just going to be presenting some of those provincial level results from those areas. So some of the areas that we're going to be reporting today are about traditional foods and medicines, cultural learning and activities for traditional wellness, and then for mental health and wellness, questions about belonging and social support, as well as suicidal thoughts and attempts. And then for primary healthcare, we're going to be talking a bit about people's perception of the quality of health services in their communities, as well as some of the barriers that they have faced in accessing primary healthcare.
Okay.
Cool, thank you. So all of these results again are provincial level. But in RHS 3 we saw high rates of people eating traditional foods often in the past year. So 69% of adults, 62% of youth, and 71% of children reported eating traditional foods often. And also 43% of adults said that they had used traditional medicines in the past year. In terms of cultural learning and activities, there's a question in the survey about who children are learning about their culture from, children and youth, sorry. So grandparents were really identified as the most frequent and common source where kids and youth are learning about their culture. So 68% of children reported learning from their grandparents, and also 58% of youth. And then parents and school teachers were both sources of cultural learning as well. And 25% of children actually reported participating in traditional activities at least once per week outside of school. In terms of mental health and wellness, this is actually a new question on the RHS, so this was the first time that this question was asked, and it was asked to adults and youth about how they would rate their own mental health. So 82% of adults, so I think that's the kind of the gray portions in that circle, reported having either good, very good, or excellent mental health. And youth report, 84% of youth reported having either good, very good, or excellent mental health. One thing that was noted in the analysis was that more male youth than female youth reported having excellent mental health. So nearly 20% of male youth said that they had excellent mental health compared to 11% of female youth. Another new question from this past phase was looking at how people feel connected to their community and the social supports that are around them. So 84% of adults said that they felt a very strong, a strong sense of belonging in their community. And 88% of adults and youth said that they had somebody to confide in or listen to them. And these are really, speaking to kind of social supports and feelings of belonging. In addition, 78% of adults said that they turn to family members or friends most commonly for emotional and mental health support, and then youth were most commonly identifying friends as the people that they turn to. So one thing that came out of this the social supports analysis was not just looking at who people turn to, but also if people didn't turn to anybody. And so a result that came here was that actually 51% of male adults and 56% of male youth said that they hadn't reached out to anybody about their emotional or mental health, compared to 27% and 30% of female adults and youth. So there was a difference there of more men not reaching out to discuss emotional and mental health problems. So we've heard also that people really want to learn about the perception of quality of health services in community, and so 50% of adults rated their quality of healthcare services as either good or excellent. So again, that's the kind of gray portion, so about half said either good or excellent. And then there's also a question in the survey about whether people received all of the care that they needed if they did need to receive care. So among the adults that did require health care in the past year, 85% that they received sufficient care, and 96% of children who required care did receive sufficient care. So this is really good news that almost all children who required care did receive sufficient care.
Mm-hmm.
In terms of barriers to accessing care, this question is asked both to adults and children, and so there are actually some differences in terms of the barriers that are faced. Adults generally actually face more barriers than children, again, potentially owing to work that's done around Jordan's principle.
Mm-hmm.
So lack of access actually was identified as the most common barrier to care for adults, and this includes services not being available potentially because of lack of wait times causing inaccessibility, or like lack of health professionals just not being available.
Mm-hmm.
Cost was also an important barrier. So 43% said that cost of services not being covered by insurance, or enabling them to get care such as childcare or transportation. And then 26% of adults cited that inadequate health care was actually a barrier to receiving proper care. And again, inability to arrange transportation, so 18%, almost one in five, yeah.
It's interesting.
So in terms of the barriers that children face, lack of access was the most common, so 37%. So again, this is, problems with accessibility because of wait times. And then cost of services, so 25% cited costs not being covered by insurance, or the costs associated with getting childcare transportation. And something that's different from the adults is actually that in the children's survey, 18% cited that the services were culturally inappropriate, and that was a barrier to accessing care. And so this survey, so for a bit of context, children are actually not filling out the survey themselves. It's actually kind of a parent or caregiver that is answering kind of on the child's behalf. So this is something that that person would have cited as a barrier to their child's care. Inadequate healthcare was also cited as a barrier, as well as difficulty in arranging transportation, 14%. So that's it for the results, and we're going to just talk a bit about some of the knowledge exchange that we're doing. So obviously we're here. So that's actually not really encapsulated in any of these little rectangles. But maybe it's self-explanatory. But so we've been doing all of these activities. So we've been sharing the results, as Catherine mentioned, with our regional advisory committee, and kind of in this past year, as the results have been compiled and ready to report. We've also been doing kind of some knowledge exchange internally at FNHA, just to kind of talk about this work that we're actually doing, and some of these results that were identified, like these the areas of interest that were identified, and then also we're preparing our website for the reports to actually be hosted there, and there's been some kind of internal communications about the RHS and how it's coming, September 30th. And then just sharing infographics and fact sheets. There's a few events coming up, or actually right now the FNHDA AGM is happening, and we sent some kind of material there about the RHS and some of the like a link to the website where you can find results. And then conferences coming up. We are going to the Nurses Education Forum to talk there and kind of like meet with health professionals. And then also we're kind of in the process of speaking to regions about potentially holding data return dinners that could happen kind of at regional caucus events or other times if there's interest. So one of the things that we heard about in terms of, because Catherine and I weren't on the ground for data collection, but just kind of hearing about the data collection process, was how people were invited into homes and they were sharing a cup of tea or they were sharing a meal. And so we are really we were thinking that it would be nice to kind of return the meal, and also kind of talk about the data and return it, bring it back to community. So that's something that is kind of ongoing in ongoing discussion, but it's something that's kind of in our minds as something that we'd like to do if people would like that as well.
Yeah, and it's also a good opportunity for us to be able to share with people the ways in which this data could be useful for their work, for their program planning, for policy development, whatever it is they're thinking of using it for, and also enables us to share information on how you might not want to use this data, because there are limitations, obviously.
Yeah, so we're talking of, because the data itself, as we mentioned, it's 200 questions for the adults, and it's a lot of results, and kind of talking about how do you actually use this? What is this good for? What is it not good for?
Mm-hmm.
Yeah.
Okay.
Mm-hmm. So we've mentioned this a few times. Oh, here we are, UBC Learning Circle on the 26th.
Would you look at that?
Yeah, so last week on that's this week. On Monday, the printed reports that was kind of the day that they were guaranteed to be in community. So I think that we've heard that they've heard from some folks that they've been received at regional offices and received in community, so that's really great. You should have it, so ask about it. And then the digital reports are going to be online on Monday the 30th, and then we're going to be just kind of doing a bit of promotion at the end of next week to kind of just let everybody know that these are out there.
Okay.
Yeah, and I think one of the things that we would like to do for this knowledge exchange piece is obviously communicate the results from the third phase of the RHS. But as we move, as we move into the fourth phase of the RHS, we have the opportunity to influence what questions appear on the next national survey. So we'll be asking for feedback and input on what people might be interested in seeing in the next survey as well.
Okay.
So we're also working on returning data back to communities. So as part of OCAP, which is really central to the RHS, access to the data is really important, and so part of having access, or in fulfillment, partly in fulfillment of providing access, we want to provide these tabular reports that Catherine mentioned earlier. So because of the expansion, that really enabled like regional reporting, as we mentioned before. So these are quite high quality estimates, so meaning that there were a lot of people contributing to them, and so there's kind of less of a margin of variability. So they're quite useful for policy and planning at the regional level, but also just to have data kind of that's representative. So there's going to be one table with all the provincial results, and then five tables, one for each region, and these will contain basically every response to every question. If it was asked to adults, the results for adults, youth, and children, and then also broken down by sex and age group. So for the adult survey, the sampling is actually kind of equal between older and younger adults. We're going to be reporting the results for adults aged 18 to 54, as well as like over 54. And so this is a lot of data. It's approximately 10,000 estimates per report, so it's really a lot. And accompanying this will be a clear and simple guide that will be that can be used to kind of facilitate interpretation and like learning about what these results actually mean and like how you can use them. And then there's also the option for communities to organize sub-regional consent to receive more granular data if they wish. So that's really part of this access piece. We know that communities might like to see data that's more about them and less kind of at this higher level, and so that's really something that we want to facilitate if possible. In terms of the sub-regional element, it really depends on the community size, and so sometimes, or I think actually quite often, a single community might have too few participants in order for us to return data while also protecting the privacy of the respondents. And so in order to receive kind of representative data that's also maybe more useful at that more granular level, there is this option to kind of organize with another community, potentially in the same nation or like nearby community, to have larger sample size so that more can be reported. Is the data still kind of close to home, but also there's more there that you can actually see. So tying into that, again, access to RHS data for participating communities is fundamental to OCAP, and RHS data can actually be requested by contacting our team, rhs@fnha.ca in big, bold. and so we really want to, unfortunately, it's not possible for us to always provide what is requested because of our data protection and stewardship policies, where we are just required to protect the individuals who participate in the surveys, but also protect the privacies of communities. So best efforts will be made to provide data while also protecting privacy.
I also just wanted to add that email address. Please, if you have any thoughts on questions for the future surveys, please feel free to email us and let us know.
Okay. We will make sure to represent that on our pages as well. I'm not sure if we'll be able to get these slides for everybody. It says not for distribution in the corner. So if that's not the case, we'll make sure to pull this information so that people can contact you.
It would be fine to share them because this data, I mean, has been released in the report. So
sure. Okay. Great. There we go.
All right. So in terms of sharing what's come out of the third phase of the Regional Health Survey, as we mentioned, we've been having some one-on-one meetings with FNHA regional teams, and this has been a really good learning experience for us in terms of understanding what the protocols are for sharing this information in various venues within the regions. It's very different for each region, so we've been having a lot of conversations trying to figure out, well, where do we go first and how do we connect with these people? So we're learning a lot, and it's been really great. We are going to be doing a fair bit of traveling this fall. We have some plans. Yeah, we have some plans to attend regional caucuses, and as we've been doing presentations, we've had more invites for people to say, hey, we want you guys to come talk. We want to hear about the survey. So we are open to invitations as well. Love to come and talk data. And as well, we're hoping to do a little bit of aligning our data return dinners, as Elena mentioned, with regional events as well, to sort of economize. In terms of the RHS4, data collection, as I mentioned, next September 7th, 2020. I think they plan that for right after Labor Day. Yes, we've started working on the request for expansion funding because we have the benefit this time in our planning process of knowing that there was a lot of interest in participation. So we're going to put that request in ahead of time, just anticipating that there will be more communities participating, then we don't have to sort of work on that request for additional funding after we've already started. So we are lucky to have that experience. And then, of course, we had our Regional Advisory Committee meeting this week. So we are well on our way to moving forward with the Regional Health Survey. We also wanted to put in a plug for a survey that is happening right now. It's also sponsored by the First Nations Information Governance Center, and that's the First Nations Labour and Employment Development Survey, also known as FN-led, which is really cool. So this one just really focuses on information about labour and employment. There's a lot of education information in there too. So not so much health related, but it's a really good opportunity for communities to participate and generate some more data that could be useful in the future. And if you're interested in that, please feel free to get in touch with us and we'll direct you to the people who are responsible for organizing that. It's not actually our team, but we're supporting their work. And this is a slide representing our current team. There's Ashley, who is in Park Royal right now. Hi, Ashley. Wish you were here. She's been with the team since July of 2018, and she is a data analyst extraordinaire. And the reason I say extraordinaire is because she has been a huge asset in terms of getting these reports ready and out the door, and all of the beautiful work that you see there was her brainchild, so thank you. Elena with us. Urson, who is in Mexico right now, he is our statistical analyst, and he's responsible for a lot of the analysis that was done for the reports. And then there's me.
Okay.
All right, thank you. So that's our presentation, and we are happy to stick around and answer some questions as best we can.
I have a couple questions built up over the course of the presentation, so maybe while I'm asking those, I'll ask everybody that's online, please feel free to populate that chat box with any questions that you do have. I'm going to circle back a little bit to a question that we had from an individual. Sharon asked, how was the survey distributed to individuals? Now, I know we talked about, it seems that you guys kind of disseminated the survey out to regional teams, I suppose, and then those regional teams became more specific and even community teams, and then those individuals then performed the surveys sometimes in people's houses, I guess. Does that kind of sound like an accurate model, or that's just my understanding from the presentation? Can you guys maybe delineate that a little bit more?
Sure. So people are kind of randomly selected to participate. So the way that the sampling worked is that communities kind of were included in the sample potentially. So as Catherine mentioned, there were some regions where like all communities were eligible to be included in the survey, and then from within that community, individuals are randomly sampled to participate, and then there's actually the survey was administered actually like on a tablet or like
one of these.
Yeah, a computer or something. Yeah. So the data collectors would meet with the people who were kind of selected to participate and go through the survey with them, so people could fill in the survey if they wanted to themselves, or kind of work with the data collector to kind of facilitate that.
Like an interview.
Yeah.
Okay.
Yeah, so it wasn't like a paper survey that was in the mail. It was actually that, the data collectors came with the tablets to meet with people.
Very structured process.
Yeah, and it also added an extra layer of protection for the data, because when the data goes onto the tablet, it doesn't actually stay there. It gets uploaded pretty much right away to the server. So nothing's ever stored on the tablet.
Okay, great. Okay, so then we have another question. Are you doing any community engagement for RHS4 in addition to the regional engagement? And will you be going through an ethics approval process for the next survey? So I'm sure that you guys went through an ethics approval process for RHS3. So can you maybe shed some light on kind of how that process worked in terms of designing these surveys?
Yes and yes. Yes and yes. There's definitely going to be an ethics process for this. So the national body has its own ethics review process prior to the survey being launched. And the regions will also, when I say regions, I'm sorry, I mean the provinces that are participating in the survey will have their own ethics process as well. So that's something we've just started looking into in terms of how it's going to look in British Columbia. We have a lot of options for what that can look like. It's pretty much up to us to design what we want it to look like and how it's going to roll out. But there will definitely be ethics process, and that'll of course include all of the privacy pieces, all of the information management pieces. It'll include reviewing the consent forms and ensuring those are appropriate, individual and community consent forms, or band council resolutions as the case may be. In terms of community engagement, absolutely. I would love to hear from people, like I said, if they have questions about possible content for future surveys would be wonderful. And I have to say that one of the things we're thinking about for future reports is how do we include more people in the report writing process who provided the data, right? I haven't really seen any examples so far of where that's happened, and I would love to be able to really involve those folks who provided the data to give life to that data and to give it meaning, rather than the standard reporting where you do your literature review and you give those details to help support your findings. I think there's other ways that we can potentially do the reports in the future.
Do you have anything to add on that? Catherine kind of hit it on the head there.
Yeah, I don't have anything to add to that.
Okay. So I apologize. I'm going to be backtracking quite a bit here. I was interested in the privacy impact assessment that we talked about a while ago. My question was, who is in charge of that assessment? Is it a case of like you guys as a team kind of assessing yourselves, in which case, or is there a separate unit that does that privacy impact, and kind of what does that process look like, I guess?
Well, the way I understand it in the third phase of the regional health survey, I believe there was sort of a standard template that our organization provides with specific privacy considerations, and we complete it, and then the privacy office reviews it, and they're very well versed in the aspects of protecting data, so they review it and they give us feedback, and we change it as needed.
Mm-hmm. Okay, so it is an independent body that kind of facilitates that for the most part.
Yeah, well, it's the FNHA privacy group.
Yeah.
So, yeah,
as
so
independent
it's
as
independent in the sense that it's not our team, but but to meet the privacy standards of the organization, and
Sure.
Yeah, and they're well versed in provincial privacy legislation and requirements. So if there's anything that doesn't look right, they can advise us ahead of time.
Sure. So then I had another question, which was getting kind of more into the data part of it now, or I guess the results part, or interpretation. How does this data go on to influence policies, like particularly when we're talking about, you guys produced a provincial data set, I guess, right? Which I kind of have questions about how that was produced as well. And you have regional, right? So what is kind of your guys' goal as a team? How is this data going to then influence regional health policies, or like kind of what is your ideal, I suppose, in that respect? What are we trying to impact here?
Well, yeah, so I guess to your point about the provincial and regional results, like we are doing reporting kind of at different levels, and because there are really different needs, and so in terms of the kind of regional reports, we're really hoping that the regional health teams can kind of identify areas that they want to focus on, or kind of do advocacy essentially for what their own needs are. So part of this, I think, is providing that in order to kind of help that discovery and start that process where people can kind of point to data as well as other evidence that they have, and kind of say this is where we are, this is where we like to go. But again, there's so much, so part of it is just kind of understanding what is even in there, and what you can look for, but then also I think Catherine can maybe speak to more about what's happening in terms of the population health goals agenda and stuff like that, and Indigenous Women's Health Report.
Yeah, no, I really like that question, because it's something that I've been thinking about for quite a long time. So you've gone through all this work, and people have put in all this effort, and people have given their time. Now, what are we going to do with what comes out of it? And the goal was never to be prescriptive. It was never to be okay, well, this is what we found, and this is what you guys should do. But that being said, there are some suggestions made at the end of the report, kind of at the end of each section, basically summarizing, okay, this is what we've heard, given that these might be some of the options that people might look at in response to these data. I think using this data organizationally to inform any of our policy or programming or services, I think we still have a little bit of work to do on what that might look like. But because Elena, like you said, it's really designed to be following the principles of OCAP. It really is designed to be used by the regions and by the communities to do planning there and to reflect their needs rather than FNHA's needs.
Mm-hmm. It can be a resource for communities. And
Yeah. That being said, I think there's still a lot of potential with the data to be worked with in terms of discovering opportunities for future research. Right? So looking at the data and saying, oh wow, this is really interesting. Something has come up. Is there a way that we could do future research at another time to really explore these findings? That's kind of cool. Yeah,
definitely. I think that brings up another question that I had a little bit later on, was kind of around ongoing consent to their data, and I suppose how that works as you guys, or not you guys, but generally, particularly when we're talking about a region, right? And the region is made up of X number of communities. And you mentioned that there was a process that people could go through to request a sub-regional data set. to influence their own policies within their communities. But then we also talked about how some communities are a little bit too small for that to be viable because of privacy and stuff like that. So my question was, how, as like a small community that maybe can't request their data, how are they going to benefit if another community within their region withdraws their consent? Because then it seems like, to me, at least from my very limited understanding, it seems like that community then can't really get any data from this process. That kind of takes away some of that reciprocity. Or am I just wrong? I don't know. I'm not a data guy at all.
Neither am I.
Yeah. So in terms of obtaining consent for these more granular level data sets, that's actually something that we're kind of thinking about now, because it is the case. So when I was talking about kind of like if a small community can't get their data, it's because of essentially there are data suppression guidelines. So we would be suppressing information in order to protect people's privacy. And so the reason why we wouldn't provide it is because it would be like all suppressed or mostly suppressed, and so it's not really
There'd be nothing there.
useful.
Right. Okay.
Yeah, but in terms of kind of releasing data where communities would work, like multiple communities potentially would organize like a sub-regional consent. Each community would provide consent, and at this time we haven't really thought about this possibility of like, oh, what happens if one community does withdraw? That would impact, but that would have an impact. But we would then kind of have to work around it. It's kind of an unfortunate fact about the survey that it just is not like the sample sizes aren't large enough to provide data to every community at the community level, and that's kind of that's definitely a drawback to the survey in general. And so so
I think it's important also to point out that we are doing this work for the first time as an organization.
I was just going to say, the timeline,
really? In terms of data governance policy, so who has access to the data. It's quite exciting. So often we are sort of not making things up as we go along, but we're having these conversations as we go along. We have a couple of data governance committees within the organizations that are comprised of executive level members who have a lot of experience working with data. So they provide a lot of guidance on how the data could be used as well.
Okay.
Yeah.
Yeah. I imagine it's an incredibly complex thing, and I really applaud and appreciate the work that is being done. I agree, and I think it's critical that we have this data, like particularly as we talk about influencing policy. You know, there are some situations where those are like our communities, we need data to influence policy, not just at a regional level, but then to go onto trying and influencing provincial or even national policies. There's going to come a point where we need data to back up what we're saying that's affecting our communities, or things that we would like to see done differently. So I think this is a fantastic first step. But yeah, absolutely, I really appreciate that kind of attitude as we move forward. That it's going to be difficult. You know what I mean? The RHS is not. It's not a survey done by Statistics Canada. You know what I mean? Like, it seems that you guys hold community values as a core component of what the work that happens, and necessarily sometimes that kind of complicates things. But it's important that we do that work and engage in that way, not just for ourselves, or not just for you guys as a project, but also for projects that come afterwards, right? So we have a couple follow-up questions. Sharon then asks, surveys conducted in person? Yes, they were, Sharon. And will dental health be included in the surveys? Is dental health represented in the surveys at all? I wasn't picked.
Yes.
Yes. Okay.
There are questions about dental health, and potentially in the next phase, it'll be kind of the name of the section will be changed to oral health. That's a possibility.
Sure.
I know that we've heard in some of our regional meetings that like oral health is a big priority.
Yeah.
Yeah.
Okay. Great. Yeah, we're hoping to have an oral health session in the spring, so stay tuned
cool.
for that. So
It's
then,
very important.
Yeah. So Sharon asked another follow-up question. In the survey, is it kind of multiple choices, or is there an opportunity to give informative answers or to elaborate more? And I'm sure that those different types of questions then give you different kinds of data points that you can use in different ways. You guys kind of shed some light on that?
I would say it's largely multiple choice.
Largely multiple choice?
Mm-hmm. There are some places where qualitative data, or I guess participant stories, are collected, but there isn't a lot.
And was that done to try to simplify data points in some way to make it more kind of, what's the word, quantitative, I suppose? Or
that's a really great question. I'm not sure.
Yeah, so I think one of the things about the survey is that it is a national survey, so that is possible, but it's definitely something that we've been talking about, is really how are we incorporating qualitative data and other ways of knowing this kind of not just numbers but also stories, and how does that get incorporated? Those discussions are happening kind of ongoing right now, but yeah.
Totally.
You did remind me of something, though. In terms of the survey design, it was partly designed to mirror the Canadian Community Health Survey, which is done by Statistics Canada every few years, and that's of all people, First Nations or not First Nations, who don't live on a reserve.
Okay.
So I think it was designed originally in mind with potential comparability. We haven't done that, and the reports that we've produced do not compare. So, but I think that's what they had in mind when they originally decided that they were going to do the multiple choice questions.
Okay, thanks. So we have another question from an attendee. Is the data still relevant even though it was collected in 2015? So I imagine a lot of the questions, they're pointing towards larger trends that can, that don't change that much from year to year. But have you guys given consideration, or is that kind of factoring into your decision to be rolling out RHS4 when you are, to reflect the changing health, shall we say, climate?
Yes, and the different issues that are arising. We are definitely seeing that in RHS4. So on Monday, we spent a great deal of time going through questions that were sent to us by FNIGC, collection of proposed questions from various national organizations, and a few things came up that weren't on the past survey, but they really reflect what's happening out there. So for example, cannabis was legalized last year, and people really want to know more about that. There really isn't very much data out there on how it impacts health. So it does change in response to what people are needing to know about or what's happening out there.
Okay, great. Anything to add to that, Ellen?
Yeah, I would just say that I definitely hear that point that it's not data from 6 months ago that we're talking about. This is data that was collected between 2015 and 2017. So it is not the most current. However, it is really comprehensive. So while it may not be the snapshot from this year, in terms of actually using the data and to kind of as kind of a snapshot from a point in time, and for planning and kind of looking at some evidence to support other evidence that you see. I think that still does, it is relevant in that way, even though it's not it's not from today. But yeah, and then the other thing too is because there were so many communities that participated in the last phase, which was amazing, in the next phase as well, that kind of seeing the change from the last phase to this phase, that's useful information as well. Yeah.
That's a really good point. We should also mention that in the report, where there are comparable indicators, change has been measured and it's been reported as well. So in certain areas you can see from phase 2 how it's changed to phase 3.
Okay.
Yeah.
Great. Awesome. So then, getting back to, I guess, my line of questioning on the provincial data generation kind of, I'm sure that you guys have very complex statistical models that I would never even begin to understand, but can you maybe give me a layman's idea of how we generate provincial data when, even during our presentation we talked about kind of a lack of participation from the Northern Health region, and when we're talking about generalizing provincial data, there's obviously vast differences in kind of population, in the population of the different regions that participated. So were certain populations kind of normalized, or was that something you guys thought about as you were as you were kind of moving forward with communities and kind of electing individuals to participate in that, or is that something that was done like retroactively after we'd gathered the data? Do you see what I'm trying to get at here?
Yeah, so I think
Okay.
My response is like, I hope it's not too technical. But basically, so for the provincial level results, the way that the reason why weights are used is because they're kind of meant to kind of weight an individual's contribution relative to like the number of similar individuals, based on where they live, based on their age, based on their gender. So like how likely were they to be included in the sample? Like, say if there's a community where, there's like more elders, there's like a generally older population compared to like a community where there's a generally younger population. The community where there's like an older population, potentially the people sampled in that group are going to have kind of a smaller weight compared to the younger people
in that same community.
Yeah, because just depending on like how likely it was that they were going to be included in the sample, and really the weights are kind of really just based on like these like characteristics, the age and geographic and gender characteristics of the survey participants, but the goal in the analysis is for the provincial reports and results is to kind of have the results be representative of what we know the like BC on reserve First Nations population to be. So like based on those gender characteristics and those age, those kind of demographic characteristics, like children versus youth versus adults, and like those distributions as well, like across the province. So that's kind of, I don't know if that was clear in any way, but that's
complicated.
Okay.
Yeah.
But that's how that's sort of how the results are generated. Yeah. So so it's meant to be representative of the greater population. Yes. Really, is why there's weights and like why you do this weighted analysis by region. So it does take into consideration like if there were communities that weren't included in the sample, like to ensure that the results would still be representative of like communities not participating. Yeah.
Mm-hmm.
It's pretty much impossible to do a survey where you include absolutely every single person.
Of course.
It can't be done. And for a lot of reasons. Number one, it would be extremely expensive.
Mm-hmm.
Right? It would be, so they use the statistical techniques to estimate what it would be like if we were looking at the whole population.
Yeah, of course. Okay, so then we have some more questions from community members. One asks, will it take this long to get RHS4 results? And no. I think they're referring to the weight there. So we're going to say no.
We're going to say no.
As we streamline the process?
Yes, reason being that we hope to automate some of the data analysis processes in the future. We inherited a little bit of a cumbersome process, I think, in terms of analysis from FNIGC. So I think we've got some new ideas around how we're going to work with the data and be able to produce things a lot faster.
Good, great.
Than in the past.
Cool.
That's my goal.
Well, that's the goal. This is an interesting question. Sharon asks, FNHA recently turned to private carriers for some aspects of healthcare. Will this change the style of questions on the upcoming survey?
That's a great question. And somebody brought that up on Monday when we had a regional advisory committee meeting. I understand that some of the benefits have shifted to Pacific Blue crops, and she was asking very similar, is that going to affect, how the data is, how the data changes across the surveys? And to be honest, I'm not sure what that's going to look like or how that could be captured. It kind of actually led to a larger conversation around the need to collect better data on healthcare access in general in this survey, and particularly since FNHA is shifting to more of the primary care approach. There'll be quite a need for data to inform all that work.
Yeah, that's where my mind first went when I read that question. I was like, oh, thank God we had the RHS in place before that time. So at the very least, we can now use this data to look at kind of the effects of these changes as we change.
Yes, it would be really neat. But the question is, like, how do you account for that? How do you know that it was a result of this benefit switch? Or how do you know? Correlation
versus causation.
Yeah, exactly. Or how do you know it wasn't just some completely random cause? Because the survey isn't designed to show us that.
Yeah.
That's the problem.
Right. So we'll give you guys a couple more minutes to populate the chat box. I have one more question. Thank you very much for addressing all of my questions. Both of you, by the way. So my last question was the Regional Advisory Committee. You guys talked a little bit about. Who makes up that committee?
That would
Not
be...
specifically, of course. But
well, it would be... We invited a large range of people to come. It would be our regional staff. So we started with regional executive directors, and they often delegated some of their community engagement coordinators or some of their planners to come. We reached out to people who were part of the committee last time. So there were a few folks from the interior. They had a technical table, I understand, for the last phase. Some of those folks were invited. We did invite a couple of provincial partners to come to the table. And it was really designed so that people who were at the table brought their own perspectives to the work, as well as the perspectives of the organizations that they worked for, the regions that they were from, and possibly even the communities that they were from. So it's quite a wide variety of people. And then FNHA staff as well. So for example, us.
Okay, great. So it doesn't look like we have any questions yet. I'm going to take the last couple minutes to do my little plug here. We have some really exciting sessions coming up on UBC Learning Circle in the next couple of weeks. One of them next week being Lisa Boyven's going to come, and she's going to do a couple workshops on campus, and then we're going to chat with her on the Learning Circle about kind of illustrating resilience and how she's taken her decolonial approach to her art and kind of how that impacts mental and emotional health and well-being. So I'm really excited about that session. It should be a lot of fun. And then we have Denise Finley coming back to talk to us a little bit about science of attachment. And then moving forward, we have community nurses are going to come in and talk to us a little bit about the role that they play in communities. We have the Dudes Club coming in to continue our conversation on Indigenous healthy masculinity. We got all sorts of great stuff planned. So please make sure to check back on our website regularly. Looks like we have one more question from Ashley. What supports are available for communities to access or do research with RHS data? I'm glad you saved that one to the end, because that's probably quite an
That's Ashley's question. What supports are available for communities to access or do research with RHS data? What a great question. And I'm not sure that I have the answer right at this moment. I know that as a team, we've been working towards addressing how we can approach community data return better, how we can be more responsive. And I think part of the challenge for us is the capacity that we have. We are limited. Our team is 4 people right now. So I think that sort of leads into our goal to do more work to enhance people's ability to work with the data, right? So during the knowledge exchange pieces, to, like I said, to be able to help people understand what they can do with the data and what they can't do with the data. And Ashley, if you have any thoughts about your question, feel free to provide them as well.
I imagine that you guys would be more than open to continuing that conversation through the email that you provided as well, right?
Yeah. I mean, if we had all the money in the world, I would just love to have a team dedicated to that piece. Some really amazing work that could be done.
Great. And then Sharon says, thank you for an informative session. As a First Nations healthcare provider, I found this information very interesting. We're glad that you, I assume that we are glad that you enjoyed it.
Yes, thank you, Sharon.
And thank you all very much for your questions. I'm glad that everybody was very engaged. So I think at this point, unless there's any closing comments from either of you that you'd like to make?
No, other than thank you. Thank you for the
thank you so much for
opportunity.
having us.
Thank you.
It was fun. I've never been on this side of the camera.
Yeah, that was something we didn't address, but Catherine's actually, in past times, has been on the other side of the Learning Circle camera, so it's kind of a neat little full circle moment within the Learning Circle.
They circle the circle. Very
Circles
good.
and circles. So from all of us at the Learning Circle, I really wanted to say thank you all very much for participating. We appreciate it week in and week out, and I look forward to seeing you next week. Until then, take care. Bye.